We're certainly seeing an increase in the number of flu cases here in Calgary. According to AHS, 236 people have the flu in the Calgary zone right now. And of those, 23 people are in hospital, with one person in intensive care. Dr. Eddie Lang is joining us now. He's the clinical department head for emergency medicine for the Calgary zone with AHS. So, Dr. Lang, I can't recall the last time I had a conversation about the flu in almost May. How unusual is it to see cases at this time of year?
Oh, it's really unusual and almost incredible that the last two winters have gone essentially without a flu season. No one would have ever imagined that such a thing would be possible. But it's not just here. It's been seen in Asia and in Australia. We eradicated the flu for the last two winters, and not surprising now as travel picks up and people are in closer contact that it's making a resurgence.
So that's it. You think it's travel, closer contact, fewer masks being worn, that sort of thing?
That's right. And the flu virus has made it back into our community. It's not the kind of wave that we see normally over the winter months, which is fueled by the Christmas holidays where people are largely staying indoors, but it's still a cause for concern and something to watch out for sure.
Well, tell us about that. I mean, how bad of a bug is this one?
Well, it's difficult to say because we really have only two dozen people in hospital and one in ICU. Normally, at the peak of the flu season, which comes in February and March, we often have hundreds of people in hospital, and our healthcare system often is under a lot of pressure during that period of time. Typically, emergency departments are full of patients who are elderly, who require oxygen, and who are waiting for beds upstairs in an overcapacity hospital system. Flu is not causing that kind of strain right now, and it's really more about COVID, and we're hopeful that this sixth COVID wave won't create the same kind of pressures that we've seen during Delta and Omicron.
Yeah, well, it's good that you're not having the compounding pressure of hundreds of flu cases swamping hospitals. You mentioned COVID. Are people confusing the flu and its symptoms with COVID right now?
Well, it wouldn't be a difficult thing to do because they are very similar. COVID will give you a sore throat. We'll start with a sore throat. We'll give you muscle aches. We'll give you cough. We'll give you fever. And so will influenza. So there's a lot of overlap. And, when we test someone, we are often testing for multiple things at the same time. And it's often, sometimes we're surprised to see influenza come back positive. I had one case today, actually. But normally what happens is we expect it to be COVID, given the epidemiology and the prevalence of the COVID virus now during the sixth wave.
And so if somebody's at home and they have symptoms and they break out the test kit and it comes back negative, as we know, COVID may still be there. They just haven't tested positive yet, but they should also be thinking, you know what, it might be worth getting a flu check, a test.
Well, it depends on how sick they are. If they're really unwell, if they're having chest pain or shortness of breath or super high fever, well, then for sure you might want to come and see us in the emergency department to make sure that everything's okay. Short of that, if your symptoms are not severe, then you may just want to ride it out at home as we're recommending right now for a COVID test. If your symptoms are quite pronounced and your COVID test is negative while your symptoms are active, there's a pretty good chance that this actually is either a severe cold or in fact influenza. And unless you're immunosuppressed and might need medication for the treatment of your flu or are very elderly, you probably don't need to have a confirmatory flu test, as would have been the case several months ago for COVID. And so the numbers that you're reporting are probably just the tip of the iceberg, actually, and that there are many, many more people out there who probably do have the flu. They just haven't tested for it.
How long do you think we'll see that iceberg floating around? How long do you think cases could continue to climb in Calgary?
Well, it's difficult to predict, but hopefully not too long. And the reason for that is because the flu really thrives on transmission through indoor environments. And two things that we've learned over the course of the previous flu waves and the current pandemic is that you just don't go into a public place with other people, an indoor place, if you're sick. We didn't pay as much attention to that rule before the pandemic, but now it's, I hope, unheard of, and no one would dare consider walking into a crowded place, especially maskless, if they have a sore throat or they're coughing, because they're going to pass whatever they have to other people, whether it be the flu or whether it be COVID. And then, of course, the other thing is that as the weather lightens and more people are spending time outdoors and not indoors, flu generally recedes and tuckers out and is not quite as problematic when we're spending so many hours in the beautiful Calgary sunshine.
But it will make a return when flu season comes around. So you make an interesting point. I mean, most of us have gotten in the habit of distancing, masking indoors, staying home if symptomatic because of COVID. Are you hoping those habits will help keep flu counts down in the future?
Oh, absolutely. And it's not just about the flu. The common cold has also been greatly suppressed over the last 2 years, and the common cold is not a big deal for maybe me and you, but for an elderly person or for someone who suffers from a chronic lung disease, it's a big deal. And we've seen a dramatic reduction in hospitalizations for non-COVID respiratory illnesses, namely smoker's lung, also known as COPD or chronic obstructive pulmonary disease. That remains way down even 2 years out after the start of the pandemic, and I believe that that's because we have greatly reduced the transmission of the common cold.
Lessons learned. Dr. Lang, always appreciate your time. Great chatting.
Always a pleasure, Rob.